From the north side of the San Francisco Bay to Singapore, welcome to Urban X Real Talk Fitness Radio with your host, business owner, lecturer, author, master trainer, Tiaja. With over 30 years of experience in the health and fitness industry, he will challenge the fitness between your ears. So prepare your mind, body, and soul for the revolution of self-care, the evolution of fit, with real talk about real people, real health, real fitness, and the real deal behind our present illness culture. Real talk every time, all the time. Get weekly insights on how to shift your thinking, emoting, eating, training, hydrating, goal setting, and resting for you, the everyday athlete. You can cheat your fitness, but you can't steal your health flow. It's Tuesday, 9 a.m. Let's flow.
Democrats seized control of the House of Representatives last Tuesday, prompting cheers amongst their constituency, including, oddly enough, for pre-existing medical conditions. Now, during a speech at the Democratic Party headquarters in Washington, D.C., Nancy Pelosi, the House Minority Leader, said that the flip will restore checks and balances. And for more than 130 million people living with pre-existing medical conditions, those on Medicare, Medicaid, and the Affordable Care Act, tomorrow will be a new day in America. Now, as the audience reacted to her words, Pelosi doubled down and added, "Let's hear it more for pre-existing medical conditions."
Today is more than about Democrats and Republicans. It's about restoring the Constitution's checks and balances to the Trump administration. It's about stopping the GOP and what Mitch McConnell's assault on Medicare, Medicaid, Affordable Care Act, and the health care of 130 million Americans living with pre-existing medical conditions. Let's hear more for pre-existing medical conditions.
Now, I don't know about you, but what Ms. Pelosi said didn't sit right with me. Why would the presumptive next House Majority Leader make something as controversial and frankly nebulous as pre-existing medical conditions her party's clarion call a victory? Healthcare, we are told, was an important issue weighing on voters' minds this election. According to some exit polls, more than 40% of voters considered healthcare one of the top issues facing the country, compared with 23% who named immigration, 21% said the economy, and 11% pointed to gun control policies. As the so-called baby boomers fast approach retirement, every economic indicator suggests that their so-called age-related healthcare issues will have a grave effect on the economy. Well, enough of the prognostications. Here are some facts. The nation spent 17.8% of its GDP on healthcare in 2016. Meanwhile, the average spending of 11 high-income countries, according to a report published in the Journal of American Medical Association, Canada, Germany, Australia, the UK, Japan, Sweden, France, the Netherlands, Switzerland, Denmark, was only 11.5% comparatively. In other words, per capita, the U.S. spent $9,500 per person. Now, that's nearly double what the other nations spend. What's even more troubling is that when compared to the average of all the nations, Americans appear to go to the doctor less often and spend fewer days in the hospital after being admitted. One of the popular criticisms is that the American medical system has an unnecessarily high number of specialists who typically earn more than general physicians, and that ramps up the spending. Now, I'll delve into the reasons for so many specialists in America in a future episode, but let it suffice to say that the creation of the specialists has been instrumental in driving the price of healthcare well beyond the financial reality of the average American. Author Ashish Jha, a professor of global health and director of the Harvard Global Health Institute, said in a press release, "These data suggest that many of the policy efforts in the U.S. have not been truly evidence-based." Now, it's clear that the real difference between the American healthcare system and the systems abroad is pricing. Specialists, nurses, and primary care doctors all earn significantly more in the U.S. compared to other countries. Get this, general physicians in America make an average of $250,000 a year, which is double the average of generalists in other countries, where pay range from $86,000 in Sweden to $154,000 in Germany. Administrative costs, meanwhile, accounted for 8% of total national health expenditure expenditures in the U.S. For other countries, that ranged from just 1% to 3%. Healthcare professionals in America also reported a higher level of administrative burden. A survey showed that a significant portion of doctors call the time they lose to issues surrounding insurance claims and reporting clinical data a major problem. And with more than 900,000 doctors in this country, that means we pay an extra $100 billion a year in doctor salaries. That works out to more than $700 per U.S. household per year. Now we can think of this as a kind of a doctor's tax. So knowing these immutable yet highly disturbing facts, why would Nancy Pelosi and the new Democratic majority in the House want to make pre-existing conditions the epicenter of their political universe? Welcome to Urban X Real Talk Fitness Radio, where we challenge the fitness between your ears. I'm your host, Tiaja. There is little evidence to support that Americans have systematically better outcomes when seeing a specialist. In fact, the increased use of specialists does not appear to be driven by medical necessity at all, but rather by political wrangling, power struggles that promote the administrative agendas of the healthcare conglomerates while making backdoor policy agreements which don't show up as improved healthcare for Americans. When even family practitioners clock in as earnings more than $200,000 a year that catapult them to the top 1% of the wage earners in this country, then clearly the system is broken. Now I'm inserting a link to a Business Insider article from April 2016. It chronicles average earnings for doctors based on their specialty. You should check it out. Believe me, you'll find it eye-opening and highly instructive. Not to mention, it will likely answer many of the questions why you have to go through the medical chain of command before seeing one of these specialists. It's one of the primary reasons why you'll have to pay on an average $1,200 for an MRI compared to that same MRI being administered in Australia for $350. Yet the Democrats are telling us that the good fight is for pre-existing conditions. Again, no single payer provisos are even mentioned. I suppose that ship sailed during the change of administration. Still, where does that leave the average American? And what is a pre-existing condition anyway? Is it an illness or a chronic injury that leaves one incapacitated? Is it the beginning stages of breast cancer, the late stages of diabetes? Let me tell you what it should really be. The word pre means to come before, and the word existing means something that is current or prevailing. So if we are going to use the term pre-existing conditions, then let's not change the meaning for political expediency. Undoubtedly then, a pre-existing condition should mean something more akin to prevention. The focus of a pre-existing condition should be optimizing health, not treating illness or disease. Why? Because the goal should be to create an environment where health is the ideal pre-existing condition, assuring that the individual is less likely to contract a debilitating illness or chronic disease in the first place. So it makes sense then that the only pre-existing condition the medical industry as well as the political pundits should be interested in for the American people should solely focus on health rather than treating disease. Today will be just another day unless you decide it won't be. It is Tuesday, November 13th, 2018. Let's flow.
A few minutes ago, we were talking about one of the big issues for the Republicans in the midterms, immigration. Now, for the Dems, health care. And perhaps the president realizes that, tweeting earlier that the GOP will protect those, he says, with pre-existing conditions and do so better than the Dems. The Donald Trump tweet from earlier today. Let's bring in the Republican governor of the state of Maine. Paul LePage has been involved in many of the healthcare debates over the years. Good to see you, sir. Thank you for coming on. I want to start with that concept. The pre-existing conditions have become a huge campaign issue, especially in many of these House races around the country. And the Democrats have been using it in so many of their ads, been hammering Republicans. We'll protect you on pre-existing conditions. The president apparently says the opposite is true. What's the Republican plan, as you know it, to protect pre-existing conditions? Is there one?
Well, here in the state of Maine, pre-existing conditions are a state law, and we've had it for years and years and years. And the Democrats are going after the House seat and saying that Bruce Poliquin, for instance, is bad for pre-existing conditions. Well, Bruce Poliquin's running for Congress, not for a state office, and therefore he has no say in it because it is a state law. I believe pre-existing conditions, the president's right. We do a much better job. In fact, the state of Maine was leading before Obamacare came out. We had a high-risk pool, and we were taking care of everybody in the state of Maine at a much lower price. But President Obama, when he brought in his insurance program, it outlawed our high-risk pools.
Oh, so that's interesting. 'Cause on a state-by-state level, you could be having a different conversation than on the federal level, because Obamacare, the Affordable Care Act, is the law of the land federally. If that individual mandate goes away, the protection for pre-existing conditions in other states would go away, right? Your state would be the exception to the rule.
That is correct. If it's purely from the federal government, yes, it would go away. But many states, like the state of Maine, we have it in part of our insurance program that it's already covered. And so anything that was changed in Obamacare would not affect us.
What does it tell us, or what does it tell you, that when we talk, I think this is true, you can correct me if you think I'm wrong about this, but the big issue for Republicans, generally speaking, in this midterm, the president talks about it all the time, we were talking about it a few minutes ago, is immigration. Fires up the base, it looks like it maybe help them on turnout. But health care is the big one for Democrats. I mean, many people wouldn't have predicted that a few years ago. Do you think it's a messaging issue, substance issue, or just as simple as this pre-existing conditions and Obamacare debate? What do you think is leading to that?
Well, I think it goes all the way back to, if you want your doctor, you can keep him. If you want your insurance policy, you can keep it. It was just, we were sold a bill of goods, and after it took effect, we realized that it was more expensive, higher deductibles, and it's just unaffordable for American people.
Well, that's the argument
the Democrats
for
have been
Republicans.
living on that.
When those stories were in the news, that's when it was helping Republicans. That's why I'm saying that's why it's kind of a surprise. It seems like it's flipped. I mean, the Democrats are the ones talking health care now
is absolutely
and scoring
flipped.
points. Why is it flipped? Why are you guys seemingly losing that argument the last, I don't even know how long, year or two?
I don't think we're losing the argument. I think the media may be projecting that, but we're all sitting back and seeing what's happening. And it's the Affordable Care Act is not at all what it was said to be. It was a switch, a bait and switch. American people are paying more, and there's only one hope, is Congress fix it. Where I think the Republicans went wrong is prior to 2016, they say elect the president, elect the House, elect the Senate, and we will get rid of Obamacare.
Right.
And they reneged on their word, and they've been paying the price ever since. If you make a promise, you got to live with it.
They didn't get the vote through, and then something. And is there a plan to replace it too? Was the question. Say, hey, you had all this time. Did you come up with something better?
They did have something better. In fact, our state was working with the federal government and with the president. And in fact, some of our people some of my commissioners from DHHS are now in Washington working for CMS, trying to bring some of the things that we know worked here in Maine to the national level. And I think that if the Republicans would, once they make a promise, follow through, then I think we'd be fine. But you can't do what happened with Obamacare.
Give me a quick thought.
That is a bad program and needs to be fixed.
Give me a quick thought, Governor, on next Tuesday night and how you think things are going to go. What's the story going to be on Wednesday morning? I know it's probably nice, right, for you not, well, maybe it's not nice, but you're not.
Now, here are my 2 cents, and feel free to keep the change. The American healthcare system is broken, and rather than fix it or address the elephant in the room, our political leaders want to fight for greater access to drugs at a lower cost. Now, that's fine, but all that really does is put more Americans on the pharmaceutical industry's payroll. No one is demanding an investigation of the drug industry itself, even though illegal price gouging has become the norm, not to mention the hundreds of thousands who die annually from medical misprescription or misdiagnosis. If we were going to get serious about health care and pre-existing conditions in America, then at the very least, every recipient of Medicare in America should have an option for a free health club or gym membership, complete with a personal trainer and nutritionist who would then provide monthly feedback and transparency with that person's primary care provider. Now, arguing for pre-existing conditions in the conventional sense is not only disingenuous, it's morally wrong. Sure, it's better than nothing, but that's my point. It's barely nothing, especially when you begin to factor in the cost of endless doctor visits and drug treatments, which leads me to my last point. Why are nearly 99% of all U.S. doctors still using a paper filing system? With all the heart monitoring and biofeedback electronic gadgets out there, why aren't U.S. medical practitioners utilizing any of it? Why do you still have to drive miles and sit in a waiting lounge for hours for a 5-minute appointment? See, it's this kind of waste that keeps administrative costs so unreasonably high, while medical inefficiency remains a major issue. Most Americans are likely to be sympathetic to the idea that doctors should be well paid. After all, it takes many years of education and training, including long hours as an intern and resident, to become a doctor. And people generally respect and trust their doctors, but they likely don't realize how out of line our doctors' pay is with doctors in other wealthy countries. However, there are no structural explanations for these kind of pay disparities. When you look at medicine in America, whether you lean left or right politically, you see something that looks an awful lot like a cartel, which is to say the medical industrial complex are the sole suppliers of medical goods and services while retaining complete control over the supply. And as I'll prove in upcoming episodes, the demand as well. Dear friends, I wish above all things that you prosper just as your soul prospers. You've been listening to Urban X Real Talk Fitness Radio with your host, Tiasha. If you like the content we bring each week, then follow us on Facebook, Twitter, Pinterest, Instagram, Snapchat, as well as all of your other favorite social media. And while you're at it, hit that subscribe button or download our app at tiajae.podbean.com. Also, check out our latest YouTube channel titled T's Universe and its podcast, T's Reverse. According to comments I receive every week, both have been inspiring imaginations and creative protests in people all over the globe. And trust me when I say, both are unlike anything you've heard before. Check out T's Universe every Wednesday at 10 a.m. Pacific Standard Time. It's 5 or so minutes that's guaranteed to change your life. And don't forget to stop through our website at www.urbanxfitness.net, where you will find our online stores, the Urban Experience Fit Stores 1 and 2. There you can download our unique home and gym workouts, our dietary menus, as well as purchase some outrageously bold teas and spark your own revolution of self-care. Also, check out our small library of my hand-picked, personally endorsed nutritional products. Okay, got it? Okay, then get it. Until next week, as always, walk in health and peace. We've been fighting this fight too long. Now it's you against me. How wrong? Where there was once a unity, all that remains is an abandoned me. Is it because I don't act like you, talk like you, walk and do the things you do? So I'm no longer black to you? I'm no longer belong to your hue? What do you want me to do? To you I'm a practical joke, in clear sight of your vision woke. To you I'm Kanye, made in America. Who am I? My humanity is me, just human being. Your diorama I'm not seeing. No matter how carefully textured and layered, in me is nuance, magical realism. I'm just saying, your life is a fable, touches of sadness. I'm the stranger in a strange land, can't touch my gladness, artfully